This clinic has been in operation for the first 3 months, and we have had, I think so, about 5, 6, volunteers come through here, including you, okay. And in our clinic in the plains, we have over 20 volunteers already come. One thing good about volunteers coming is, I have a PhD. I have 2 doctoral degrees from Berkeley and Harvard. So I have been working with students, advising students, okay, during my academic career. So one thing what happens here is that I will be able to guide and advise students, or as with Arsalan, I've gone home visits with you. So this is something I do here, and in our other clinic also. I divide my time between these 2 clinics. What you can learn here, it is not only about health, not about medicine and how you treat people, okay, but more importantly is how do people live, how do they perceive illness, how do they perceive disease, okay, what is their thought on germ theory, okay. Do they have a toilet or a latrine in their house or not? Okay. How far are the animals sheds from their house? Okay. So you get a much better perspective of public health aspects, okay, and how it relates to health and medicine. So in this area, okay, this is a hilly part of Nepal, upper mid hills we call it. The mountains are very close from here. And in this part, we still have about 50% of the, pregnant women giving birth at home, okay. Whereas, nationally, only 30% of the people, okay, go and deliver in a healthcare facility, according to 2006 data. In 2011, the percentage of pregnant women delivering in a facility, is a facility-based delivery, has come to about 38%. So we are above that average, okay. So if we could get, okay, a lot of the women, pregnant women have ANC checkups here, okay, and if there was enough of a flow here, okay, then we, we are already working on a birthing center in our other clinic. We have our own building there. This is a rented building, but one of our real goal in the clinic down in the plains, and as well as this clinic here, is to have a birthing center eventually. But in order to get to a birthing center, first we need to have gone through a lot of antenatal or prenatal checkups. Okay, we need to have that guided a lot of pregnant women so that they can have safe delivery. We have to make sure, okay, that, and we have our village health worker. We will add more people, more staff, so that we try to make sure that this whole area, there is not a single more home delivery. See, in Nepal, other thing, the government is trying to encourage a lot of institutional delivery, we call it, facility-based delivery. So if the government even pays, transportation cost, for the pregnant women, okay, those who want to deliver, the government even pays a small stipend, for women if they go and have a give delivery, if they deliver in a hospital setting. So we would like to see as many people from all around here come here, have as many as antenatal checkups as possible here, and maybe within a year or so, if we once we have 200, 300 people that are within our package and that have used our package, then it's easy for us to start a birthing center. We need to get a little more government regulations in place, and we have to meet those regulations, and we will be easily able to that. Again, please remember, the thing is, the more women we get here, the more children that come here. Okay, so for every mother, in this area, we still have about 3.5 children. Okay, so the total fertility rate, is still about 3.5 children here. So we will want as many mothers to come here, And if we can get as many mothers as possible into the clinic, we'll get their children, their husbands, their in-laws, okay, and they will also bring their other women with them. So the trick here is to work with women. But in our clinic, in both our clinics, we have two health facilities, one in the plains of eastern Nepal and one here in Jodhpati. The medications we sell are only that are allowed, or allowable according to the government's regulations. So we sell about 280 types of medications in our two clinics. I did my postdocs from UC Berkeley and from the Harvard School of Public Health, and I worked many years in Nepal for the World Health Organization and also with USAID, the United States Agency for International Development in Kathmandu in Nepal. So over the many years, with my academic background and my work on research and public health, I have gained a lot of information and knowledge. We have had several groups of people come from Wisconsin. We have from Gunderson Lutheran Hospital in La Crosse. Okay, they are trying to work with us to build a hospital in the plains. Okay, 30 to 40 bed hospital. So we are negotiating with Gunderson Lutheran from La Crosse. We have several of the doctors and come here. So we would welcome all students, faculty members to come here. One thing we really need, because our clinics are mainly, is like 98% or 90% female-run clinic. We just have one male staff. Besides that, everybody else in both our clinics are female, and we have done it purposely to elevate or raise the status of women, especially women healthcare workers. And the second is, we really want to be a clinic, that provides, well women clinic, well women services and well child services. That means that women and children come here not only when they are sick, okay, but also when they are good, so they can have routine checkups. So that means, that we also are looking, and we are already doing this, but because of certain lack of equipment, we haven't been able to do this wholeheartedly. So we're always looking for donations, of ultrasounds, okay, or USG and EKG machines, okay. But any donations, we also have had ultrasound donated to us. But by the time it arrived here, from the United States, it didn't have a user manual. It didn't even have a password to get into the screen, okay. So we have a $5,000 machine, in our other clinic in the plains, okay, that hasn't been used once because we don't know how to get into that. So this is very good intention, but good intentions alone are not enough, There has to be a cooperation and coordination with Chisang Clinic for any donations, So one of the main things, we are looking for, because we want to do, ANC or antenatal or prenatal checkups, and then that way we can look at the health of the mother and the, of the fetus. So for that, it's really, of paramount importance, that we have ultrasound or USG machine and an EKG machine for people with high blood pressure here. We don't have a doctor here, but what we can do is we can train them and train our healthcare workers here at looking at trends, okay? They get a training with the Ministry of Health of Nepal. We pay our healthcare workers to go there, and they would be taught to look at any anomalies, okay? So they know that there is something wrong with them, okay? And when there is something wrong, okay, we can send them to a bigger hospital. But if everything is okay here, we can ask them to come for the next visit and the visit thereafter. Usually for a prenatal checkup, we have 4 visits, and for difficult cases we may have 6, 7 visits. But until we have a machine and we can look, at least do 1 or 2 ultrasounds, okay, we don't know. We are unable to provide a very vital service to this community, and that is something like to buy one of these machines would be like 6 months of our budget, okay. They're just very expensive here. So, we're always looking for donation for ultrasounds and also for ECG, the EKG machines. Our healthcare providers, our volunteers, and myself, we go home to home like we have done with our salon, in the last couple of weeks here, and try to gather information, try to encourage them to come and see the patient, have the patients or their family members checked at our clinic rather than sending their children to get some medication. Okay. Also, we are different in the sense that, as far as I know, almost no for-profit hospitals or government clinics or hospitals actually send their staff, to patients' homes and try to learn more about them, okay. So we are very different because we try to do that, and we try to, be a part of the community rather than one step ahead of the community where everybody is coming to the clinic and none of the clinic, healthcare providers are going to the homes and trying to understand what kind of situation they are in, what kind of public health and medical threats there are in the community. So that's how we differ. Yes, one thing, there was another group of doctors who came from your state, great state of Wisconsin, and they had brought us a nice ultrasound. It worked perfectly, but it was it had been in the storage there for the last 10 years. They took it out, refurbished it, okay, and it was a 1987 model, I think so, 87, 88 model. We couldn't even print it with it because it didn't have a USB port, okay. And so we have a machine. We cannot print anything. We can just show them a black and white picture, and the people here can go to any other hospitals and have a colored, view a colored at a colored screen, okay, and have a nice printout on a laser printer. So for us, I think so. Any donations, would be, if you could donate something to our clinic, it doesn't have, the money doesn't have to come to us, There are some really good places in Kathmandu, big dealers, and you could talk to them, we'll provide you the email addresses and their contacts. You can make the direct payments to them. But if you do donate something to us, please donate that, donate a machine and a training package, a machine, with all the user manuals and, how to, if there is a problem, how to solve that, okay, a maintenance plan, okay, as well as a small, $500, $700 training package so that our staff here can learn about that. We don't have to hire somebody completely different, and money is already short, and for a small rural clinic like ours. So we would really appreciate, if something like that could be worked out, and if we could donate, 1 or 2 machines to our clinic, we could really do a great job and enhance our services to the poorest of the poor.